Hi. We're talking about building or putting together a toolkit that you can use to design surveys or interpret the quality of a particular study that's been done using a social survey. And one important ingredient that is now increasingly being included in population surveys, community surveys, and school surveys is screening tests. We talked a little bit about diagnostic interviews and how a full diagnostic interview is labor intensive, it takes a long time, covers a lot of psychiatric disorders. You could take one section of it and include it in a survey, but even that is somewhat cumbersome. If you don't have the time and the resources to build an extensive assessment of your population or your sample using a psychiatric interview, a good substitute is to use a screening test. So let's talk about some screening tests that have been developed in the area of alcohol and drug research that can be useful for this purpose. Screening is a procedure used to identify people at risk of developing a particular disease or a disorders. And a lot of screening tests have been developed for detecting people who are likely to have a diagnosis of depression, anxiety, and substance use disorders. The goal for substance use disorders is to identify the number of people who have hazardous and harmful substance use as well as those who are dependent. And if we can provide accurate counts in a population of people who fit into these categories, we can then design programs that serve to intervene or to manage them in clinical settings. So, screening tests can be used at a clinical level to identify people, but they can also be used at a population level. And they are, as I mentioned, increasingly being used in population surveys as a substitute for more lengthy diagnostic interviewing. The advantages of a screening instrument are that they're short, they're easy to fill out, and they're easy to score. They're useful for case finding if you want to provide statistics about a rate in a given population. And a variety of instruments have been developed for this purpose. The two that we're going to talk about are the audit, the alcohol use disorders identification test, and the assist, the alcohol, smoking, and substance involvement screening test. The audit is, by definition, focused on alcohol. The assist is a screening test that was developed to estimate the degree of involvement in 10 psychoactive substances, including alcohol. So, the first thing we want to know is whether these tests are reliable and valid, because one standard for incorporating a particular measure in a population survey, a community survey, or a school survey is that they have sound psychometric properties. And in your readings, you've heard about reliability and validity. The tests that we're going to be talking about have been demonstrated to be reliable and valid, but there are many other tests who meet this standard or criterion. So there are a large number of screening tests that have been developed, both self-report measures, but we also now have biological measures. And the biological measures are tests that often require a blood sample or a urine sample, which are difficult to obtain in population surveys and clinical settings, but it's not impossible. And the technology is getting much better. So we can sometimes take a saliva sample in a interview situation, send it to a laboratory or score it on the spot, and we can get some objective verification of a person's self-report information. We're going to be talking mainly about self-report measures because they are often more accurate than biological measures, they're less cumbersome, and they're very efficient to use. So the audit was developed by the World Health Organization for international use. So here we have an example of a test that's been validated in many countries and across many ethnic groups. There have been numerous studies that have shown that it's not only a good measure of hazardous drinking and harmful drinking and dependence, but people can be graded along a continuum of severity, ranging from no risk to very high risk. And it can be used as an interview or a questionnaire. The content of this particular screening test, which takes no more than 2 minutes to administer, boils down to 3 areas: hazardous alcohol use, dependence symptoms, and harmful alcohol use. The hazardous use questions are standard questions of the frequency of drinking, the typical quantity of drinking when people do drink, and the frequency of heavy drinking. Usually for males, that's going to be 5 or more drinks. For females, 4 or more drinks. So what we have here is a quick way of estimating somebody's alcohol consumption over the past year, and then the questions move on to whether they've experienced dependent symptoms. Dependent symptoms, as well as the drinking questions, are measured on a frequency scale. So how often have you experienced a situation where you couldn't control the amount of drinking once you started? How often do you drink first thing in the morning? These questions are used with a time frame that can be adjusted to the screening test. Often it's used as a 1-year time frame, but it can be used at 3 months as well. And people are asked to rate that particular symptom and how frequently it occurred during that time frame. And finally, there are 4 questions about alcohol-related injury, others being concerned whether there have been blackouts after heavy drinking, and whether a person experienced guilt after a drinking session. Adding all of these questions, responses together, we get a score. And that score can be used to estimate the distribution of alcohol involvement within a population. Most people will, for a past year period, probably report very little drinking. But many other people, maybe up to another 30 or 40%, are going to be reporting modest amounts of alcohol consumption that don't amount to much of a problem. We then get over the threshold of the screening test, which indicates an area of risk. And the high-risk drinkers are people who are likely to be experiencing problems, if not are likely to develop it in the future. If people score in the high range, which is 16 or above, they're going to be likely to have symptoms of dependence and frequent and heavy alcohol use. And in this case, we can suggest that perhaps treatment services or interventions might be required to deal with the number of people who score in this high-risk range. So the screening test is a good severity measure. It's a good way to estimate different levels of risk in a population. Once the audit was developed by the World Health Organization and it was disseminated throughout the world, people began to find it very useful, and they asked WHO to develop another screening test that would cover other psychoactive substances. And the ASSIST is such a screening test that covers 10 classes of psychoactive substances. You are going to be asked to view a film on the development of the ASSIST and how it was used in both clinical situations, but now more and more the ASSIST can be used in population surveys as well. So view the film and consider this as one way of measuring the intensity of involvement with different psychoactive substances in population surveys.